Wonderful. So today we're going to talk about air pollution, climate change, and how it affects coronavirus. So, Dr. Bernstein, could you start by telling me what is the most important thing that people should know about air pollution, climate change, and coronavirus?
Yeah, it's a great question. Turns out that air pollution, we have evidence now, is increasing the risk that people are dying from COVID-19 in the United States. And that air pollution has the same source as carbon pollution in the United States, which is fossil fuels. So the research looked at, in the United States, the air pollution levels across the country over the past 15 years. And people who have been living in places with worse air pollution have greater risk of dying. And in those cities in particular, the source of the pollution is either from power plants that are burning fossil fuels or from cars and trucks and things that also burn fossil fuels.
Yeah. And I know that study found that people who are exposed to air pollution are 15% more likely to die or have severe outcomes from coronavirus than their health equivalents. Can you talk a little bit about the actual difference between air pollution exposure?
Sure. So what they did in this study is they looked at the deaths that have occurred around the country from COVID, and then tried to understand how the different levels of air pollution in those different places might have influenced the risk of dying. And again, they looked over many years. So this is not the air pollution this week or this month. This is the average air pollution that has been in these places for more than a decade. And what was amazing was that the difference, that 15% change in the death rate that they found, wasn't for a big difference in air quality. It was for a remarkably small one. So in Boston, on any given day, for instance, the particulate matter pollution, which is the kind of air pollution they studied, which is really one of the forms of air pollution we're most concerned about, it might be 10 micrograms per cubic meter. And the difference they found was that for every increase of 1 microgram, there was that 15% difference. That means if you go up 2, the difference is 30%.
Right.
So these are big shifts, and importantly, that difference was found even when accounting for people's underlying health status and whether they had access to health care and their socioeconomic status, all things that can matter to whether or not you live or die from the disease. So, this effect of air pollution is above and beyond those risks. And I think that's an important point to make, is that it is the air pollution. And it wasn't terribly surprising either, because there's been lots of other research with lots of other respiratory infections showing that this same kind of air pollution is in those cases not only makes people more likely to die, but more likely to get these infections in the first place.
Right. And so like someone who grew up in like New York City versus someone who grew up on a farm in like South Dakota, that person and their health equals, how much more likely is that person who grew up in New York to die from air pollution?
More. I mean, even within New York, there are large variations in air quality. So it really depends on where you are in the city. But your point is well taken, which is that people who've lived in places with less air pollution have more of a fighting chance. And we have to acknowledge that air pollution is not an equal opportunity killer in the United States. Right. We know that particularly African Americans and Latinx communities are breathing worse air pollution in general, and the poor are breathing worse air in general. And so in the light of that knowledge and what we're seeing with death rates in, for example, the African American community, we're now wondering whether some of that difference is because they've been breathing worse air for long periods of time.
And why is it that poor people and people who are in minority communities are more exposed to air pollution?
Injustice is the short answer. We can look at a very clear example. So African Americans in the United States were essentially denied the ability to own a home. If you look at where wealth is in the United States today, for most Americans, it's their home. So that means African Americans have accumulated less wealth over generations up until very recently. Or even had the opportunity to do so. That means they could afford less, which means they're living in places that people don't want to live. Where don't people want to live? They don't want to live next to roadways. We know that people living next to roadways have more air pollution. People don't want to live next to power plants that produce air pollution. Well, housing's less expensive there. So that's why these communities that have been discriminated against historically, we see the reality of that even today in this country. And so that's just one example. There are lots of other ways in which poverty is, essentially the closest bedfellow of pollution exposure. And that's true here and around the world.
Right. And to switch gears a little bit, I mean, we're talking a lot about why does coronavirus exist? I'm wondering how did climate and the environment play a role in bringing the world coronavirus?
Yeah. So we still need to learn a lot about exactly how coronavirus moved from a bat into a person somewhere in Asia. What we know now is that it is very likely that the virus was living in a bat somewhere in Asia. We actually, I don't know, I mean, we suspect China, but, it's possible that this virus emerged even potentially somewhere else. But, odds are it was in China. If you look at other viruses that have emerged from bats into people, a good recent example that caught a lot of attention is Ebola, which happened and is still happening in West Africa. So bats were pushed into closer proximity to people because of deforestation. And this is a recurring theme, which is that when you chop down some animal's home, they move, shockingly. And that in this world means they're more likely to move to people because they need food. And so we saw that with Ebola. We also saw with another virus called Nipah virus. The first outbreak of that was in '98 in Malaysia, where bats moved from forests that had been degraded into farms because they wanted to eat and spread a virus through pigs into people there. And so deforestation is a major driver of disease emergence, of diseases like SARS or Ebola or Nipah. It's also, of course, a major problem for climate change. Burning fossil fuels, we know, makes air pollution that makes people worse off with COVID. It also causes climate change. And so we see time and again how the things we need to do for climate change are, in fact, really good things to do to help us both potentially prevent pandemics and to make them less bad when they happen.
Yeah. And then, so, I mean, with the continuing rate of deforestation and pollution, are we going to see more pandemics like coronavirus in the future?
Well, I think that depends on what we choose to do moving forward. I think this is a shot over our bow. I think, it's pretty clear nature is trying to tell us something. And the good news is that we know exactly what we need to do. And in the United States, that means dealing with the reality that, air pollution comes from fossil fuels. I think everyone needs to know that air quality for the first time in decades in this country has gotten worse in the last 3 years. There are ongoing attempts to worsen our air quality further. I'm not sure that's the wisest of ideas, especially given what we know now about this disease and air pollution. In doing so, we're going to make people healthier, and not just in this pandemic, but 1 in 5 of the children I take care of as a pediatrician with asthma has asthma because they're breathing exhaust from cars in this country. And then, of course, yeah, it's crazy. Yeah. And the same thing. So Americans often wonder, well, what can we do for deforestation that's happening in the Amazon or in forests in other parts of the world? Well, we have to be asking the companies that are sourcing goods to us to make sure that they're not sourcing them in ways that might destroy forests. And we frankly have to call on our elected officials to make sure that they're protecting us. Because, for example, our tax dollars were used to prevent this. We had a program sponsored by the U.S. government to prevent things like this, and the government, just before this happened, decided they no longer wanted to do that.
Really?
Oh yeah. So there's a program called PREDICT, funded by the USAID, which had been in place for 10 years.
What does that stand for?
PREDICT. It's an acronym. That's an excellent question, but I'm not sure. But the idea was to go to places, particularly in Asia, and look for viruses that might emerge into people, just like this one, because science has told us that this is the way this works. There's nothing surprising about this, I'm sorry to say, COVID. And so they found viruses, and in some cases, they actually took steps to prevent them from getting into people in places in Asia. And educated folks about the risks of coming into contact with wildlife. They improved the risk of transmission from wildlife to livestock, as I mentioned, was a problem with Nipah. And so they're really concrete examples of how these programs not just protected people over there, but protected
Hmm.
us. And you know, we'd like to think that if we eat the right foods and we exercise and we do everything that people like me tell people to do on a day-to-day basis, we'll be healthy. And that's true. But we also have to acknowledge that our health is actually dependent on the health of the people in our communities. And if it ain't clear now, I don't know how it's going to be clear at any point, but also
Right.
to people around the world. And so
Hmm.
we can do a lot. We can detect these things early. We can prevent them. We can stop chopping down the forest where animals live. And I should emphasize, the idea here is not to kill off the bats. If we kill off the bats, we're actually also shooting ourselves in the foot, because bats, in fact, pollinate things that we eat, and they eat insects that make people sick with emerging diseases. So the idea is to protect the bats to protect ourselves.
Interesting. Yeah. So one of the questions that I have is we're talking about flattening the curve and, we're treating tons of people in hospitals about for COVID. What should we be doing to divide the spend of government resources between healthcare and investing in healthcare systems and patient outcomes, and also preventative spend? Like, where do you
Yeah.
think that division lies, and what sort of preventative spend do you think would be effective?
Yeah, it's a great question. The answer is pretty easy. So, I mean, now that we're in the middle of this, we have to spend what we have to spend to do what we have to do, right? So we've got a huge number of people who are getting sick, and we've got to take care of those folks. The estimates are that this one infection in the U.S. healthcare system is going to be on the order of hundreds of billions of dollars of cost, okay? We've obviously seen that the economic damage is going to be on the order of $1 trillion. And so then you ask, well, how much are we spending to prevent stuff like this? Well, the
Right.
whole budget at CDC right now for dealing with zoonotic diseases is about $500 or $600 million. And as you may know, the Pandemic Preparedness Office was essentially dismantled.
$500 million. Can you give us, like, do you know any sort of comparable spend on other government programs?
Well, I mean, look, the CDC budget, or for that matter, the NIH budget for research, is orders of magnitude bigger than that.
Hmm.
uh, so, and then, you say, well, okay, so let's say, a lot of people are saying, well, what if this happens again? What do we need to do? And so then people, we need all these ventilators, and we need supplies of masks and hand sanitizer and all stuff. The costs of that are relatively small, but the truth is, the costs are not just that. Number one, we're looking at all the costs now. And then the cost of preventing this, I mean, we spend essentially nothing on the illegal and legal wildlife trade. It's probably a shocker to most folks that the U.S. is one of the biggest consumers of wildlife in the world. There's more wildlife being taken from the four corners of the planet, put through our country on a daily basis than pretty much anywhere.
Wildlife, you mean, like, what do you mean by that?
I mean, like, non-human primates, so like monkeys of various sorts, random snakes
Really?
from forests, birds, fish, you name it, being harvested all around the world, coming through us, in some cases legally, in many cases illegally. The budget for the
Hmm.
Fish and Wildlife Service on this is almost non-existent, and so it can't possibly deal with it. There are international treaties like CITES, which is intended to prevent the trade in endangered animals. Their budget is on the order of a few hundred million. And so, you don't need to be an economist to recognize that even if we, did, for example, what I said, which is like that PREDICT program, find where these viruses are, identify the people who are at most risk for spillover, try and prevent the spillover. That program, as I mentioned, was, like 20 million a year. All these numbers are in the tens to hundreds of millions, and we're dealing with $1 trillion in costs for this one event. HIV, which was also a zoonotic disease, it came into people from consuming non-human primates. That one costs the world about $50 to $60 billion every year.
Hmm.
So in terms of the breakdown, it's orders of magnitude off. We should, we spend $2 to $3 trillion on after the fact healthcare in the United States.
Yeah.
The CDC estimates 25% of deaths are preventable, and some argue it's much higher.
Hmm.
If you, deal with air pollution, if you, give enforcement of wildlife trade, if you prevent deforestation, these costs are, and that's a bargain. It's a bargain.
Yeah.
It's a bargain for the it's a bargain for the $1 trillion loss to the economy, It's a bargain for the $2 to $3 trillion we're spending after the fact on healthcare. And so, where you draw the line, you can throw a dart at it. I mean, spend a few $100 billion a year and save yourself immense amounts of not only economic damage, but this event is going to transform how we trust each other in society. I mean, they're huge societal repercussions.
Absolutely. So I want to take some audience questions. So if you guys have any questions, you should definitely put those in the comments, and we'll try and get to them. So one question coming from our audience is, could respiratory diseases potentially become more prevalent simply based on the toxic air much of the world breathes?
So we have lots of evidence that breathing polluted air makes people more likely to get pneumonia. And that's particularly problematic for the kids I take care of under 5. So in the world, under 5 deaths, a large percentage of them are from pneumonia, maybe 20 to 40%, depending upon where we are. And the lion's share of those we know are caused by kids breathing dirty air. And that's true of adults too. I mean, our risk of getting infections as adults is also dependent on it. So yeah, air pollution is a big deal for respiratory infections. And again, in the United States, the overwhelming driver of that is burning fossil fuels. In other parts of the world, it's burning forests, which are often done for agriculture, for things like cattle grazing, and for palm oil production.
And then another one that I think is really interesting and pertinent is, are we just too late to be talking about climate change? Like, can we still do things, or do you think we're sort of at this deadly threshold where anything we do is just kind of like,
there's no black and white when it comes to climate change in terms of cliffs, right? There's no cliff tomorrow. The main point for me is not about necessarily the trade-off in terms of if we do something today versus do something now. Or doing it today is better, and much better than a year, and much better than 10 years. But the real problem, or the real opportunity, is that the things we need to do benefit our health right now. So, this air pollution thing is a great example, which is, we've got maybe 100, 200,000 people who are dying every year from breathing polluted air. Those people don't have to die. They don't. And we've got, maybe a third of people in this country who are obese. And speaking of the return on investment, I don't care how we pay for healthcare. We spend so much time talking about who's going to pay and how they're going to pay after we get sick. I don't care if it's private insurance or public insurance or any mix thereof. If we have a third of adults with obesity and a diabetes rate of 5%, it's going to be disastrous. We have to deal with, for example, obesity, which means we have to get people from sitting in cars for hours at a time by themselves, which is terrible for weight and terrible for mental health and terrible for air pollution. We have to get people eating healthier diets, which means eating less meat and certainly less processed meat and less processed foods and more plants. And these things are all really important to our health and our economy right now. And oh, by the way, they're extremely important for climate change.
Right. And then something that people are talking about is, because everyone's staying at home, or a lot of people are staying at home, working from home, what is the impact of actual coronavirus on the climate? Is people not driving and stuff, will this have any sort of real effect on our global CO2 levels, et cetera?
Yeah, it's a great question. I get asked all the time. I wish I could say yes, but the likelihood is it might be a blip on the radar, but it might not even be that. Certainly emissions should be down because of this, but we have to remember that it's not like carbon dioxide goes up in the atmosphere and it's automatically there. It gets absorbed by trees. It gets absorbed by the oceans. Right. And so these natural cycles of carbon. And so, it's not a one-to-one immediate correlation. So are we going to see less emissions? Yes. Is that going to matter to the trajectory of what's happening with climate change? No. I mean, our economy is going to get started again. It's hopefully going to get started sooner rather than later. And this event is not going to matter to our carbon problem in any meaningful way.
Yeah. Okay. Well, that's good to know. A little bit disappointing, but good to know. And then what what can consumers, what can people who are watching this, what can we
Yeah,
do as
yeah,
citizens? What is the most important thing for us? Is it
yeah,
not eating meat or,
yeah.
stopping driving? What is it?
Yeah, it's two things. So the first is that anybody who's concerned about climate change, and I hope that's everybody, because as a doctor and as a pediatrician and as a dad, I can tell you that I'm in this because I have scientific basis for concern for my welfare and my children's welfare. We tend to be overwhelmed. We tend to think, what could I possibly do that matters? And the honest answer to that is that doing something is enormously important. And that could be, whether we're taking meat off our dinner plate once a week, whether it means we find a way to carpool or maybe walk or bike to school or work, or whatever it is. I mean, these solutions are out there for us. They're not going to make the global carbon budget better. But it turns out that a major challenge we face right now in this country is making clear that what we need to do is something that we do. I bike to work in Boston, which in some ways is crazy, all year. And it's not even because I'm concerned about climate change, to be perfectly honest. It's because I would go crazy driving to and from work in Boston. And I happen to be very fortunate and have a bike path that takes me from where I live to work. It is great for my mental health. It's great for getting my mind working before I get to work. It's exercise twice a day that I don't have to go to the gym to do. And then, of course, it prevents air pollution and climate change. But perhaps most important, it shows the community I live in that this is something that people do. There are no spittoons. Is there a spittoon in your room right now? Are you in your
No.
No, there's no spittoon,
Yeah.
right? There's no spittoon in mine either. Why are there no spittoons? Well, it turns out it's not because science showed us that chewing tobacco kills us. It's because people thought it was gross.
Right.
As many people recycle at the curbside as vote in many elections. Why? It's not because everybody wants to save the planet, although many people do. It's because people recognize this is what we do as a community. And when it comes to these individual actions, that's the power, is that we have to demonstrate to the community that this is what we can do. There's another piece, though, that's critical here about what people can do, which is vote. We are living in a moment where the protections to our health are being stripped away left and right, and particularly for our children. I mean, it was just announced yesterday that the EPA is going to be rolling back a mercury rule that has halved the number of children born in this country exposed to toxic levels of mercury. Mercury damages our children's brains in utero, so they don't even get a fighting chance from the get-go. And this is deemed to be acceptable. And we can talk about the details of how this came about, but the reality is that if this were just one decision to harm our children in this administration, it would be one thing. But we have seen from the very first days up till today, dozens of actions that have increased the exposure of our children and women who are pregnant to pollution that we know is harmful to them, and that those costs have essentially not been considered in decisions about whether these rollbacks were good ideas. And so we have to, if we care about our children, we have to vote for elected officials who grasp that science matters and that the welfare of our children matter. And I really wish I could say that about what's going on in this administration, but I just don't have evidence that that's the case.
Yeah. So get out and vote. That seems very important. I think we have time for about one more question. So I'd like to ask you, are climate solutions pandemic solutions?
Well, I think so. I think that's because climate change is really it really matters to everything that keeps us healthy. I didn't even talk about, think about hand washing, right? So we're supposed to wash our hands for 20 seconds. Does anyone wash their hands for 20 seconds? I'm not sure, but we're trying. What do you need to wash your hands? You need water, right? Well, water is not so available in large parts of the world, in part because of climate change, right? So you have that piece, which is if we continue to destabilize the climate, we're going to have greater water shortages, which means when pandemics happen, people aren't going to be able to wash their hands. And as I alluded to, that's not just a problem for people somewhere else, it's a problem for us, because it turns out that the germ theory of disease is true just like climate change is real. But then, of course, there's the upstream stuff where we talked about how climate, the causes of climate change, like deforestation, can be driving the emergence of this stuff in the first place. Climate change is pushing everything that can move, plants and animals, to head for the poles or head up mountainsides. And that means that animals that might be reservoirs for diseases that can affect us are moving to places that might make them bounce off people or other animals. And then, of course, there's the air pollution piece, which we've talked about. So you tackle the air pollution, you tackle deforestation, you're tackling climate change, and tackling climate change can take some pressure off a valve that gets at the ability of people to protect ourselves, whether we're in a rich country or a lower middle income country, from these diseases that we know happen. I mean, we've seen at least new viruses come into people every year for decades now. Sometimes we get lucky, they don't do much, but sometimes they're like this. You don't need to be holed up in your house for a long time to realize that this is pretty awful. Mm-hmm. And we don't need to do this again. No one wants to do this again.
Yeah, I couldn't agree more. Is there anything else that you'd like to impart on our audience before we end this talk?
I think it's really powerful how health can motivate people. I mean, you think about how our lives have been turned upside down because people are trying to do what's necessary to protect not just themselves, but others. I mean, I live in a household with folks who are generally not the highest risk people when it comes to this disease. So yeah, we're doing it to protect ourselves, but really we're doing this to protect our neighbors and our community, because we know that this virus spreads and that if we don't do what's right, other people are going to be hurt. Well, there's a logic there that is critical for us to grasp, which is that we need to do stuff about climate change because it's good for ourselves, as I alluded to right now.
Right.
It's also critically important for the welfare of people around the world. And it turns out, as this pandemic makes so painfully clear, that their welfare matters to us as well. So we need to be able to connect those dots, that this transformation we're seeing now, which is out of pain, we could make a transformation for the good when it comes to climate actions that's really going to do us a service.
Thank you so much for your time today, Dr. Bernstein. This has been really wonderful chatting with you.
Great to be here. Thanks for having me.